Hi, Laura DeJulia, registered massage therapist and NKT practitioner. I'm going to show you a breathing drill that I often give my clients, especially those who have acute pain and aren't able to start to develop strength really well. Breathing is one of the first things that we learn how to do. It's the way that we earn motor control. It's the way that we earn core stability to allow us to then progress to stages including crawling and walking and more complex movements as we age. And it's a really important part of how we start to become aware of how to well use our intrinsic core, those structures that make up the deep core that supports our trunk and allows us to distribute force outward. And so this drill I'm going to show you is called Supine 90-90 breathing. And so you're going to get into a position where you're on your back and your hips are at 90 degrees and your knees are at 90 degrees. I'm going to use a ball to support my heels, but you can use a chair or the edge of your couch. That's absolutely fine as well. So when you get into this position, you're going to do the 360 breathing drill. And if you've worked with me, then you know the 360 breathing drill. It's the drill that we start to look at when we're assessing if you can access deep core function. And so when you do a 360-degree breathing drill, when you inhale, your ribs move out to the sides, your lower ribs. Your abdomen domes from the base of your breastbone to the top of your pubic bone, and your low back puffs into the floor. And so this essentially brings your breath 360 degrees around the trunk. That's why we call it 360 breathing. And you're going to do it in a position where you're slightly supported. You can progress this drill so that you're not supported, but right now we're going to do it supported by a ball or a chair. So you're going to get into supine, which is on your back. Your heels are going to be supported by the ball. So you can see here, my hips are at 90, my knees are at 90, and my heels are supported by the ball. Not this. This is not a passive drill. I want you to have to control the position of your legs just slightly. And so your heels are the only part of your foot that is supported, and you're also not kind of just hanging out here, right? The knees are in line with the hips, the toes are facing the ceiling, and you're controlling, on a small degree, the position of your legs. And then you want to become aware of the position of your pelvis relative to the lower part of your rib cage. And so your thoracic diaphragm, here, the muscle of breathing, and the pelvic floor, they like to face each other. And so they don't want your ribs tipped up or tipped in, because those two diaphragms want to face each other so that they can complement their movement. And so become aware of the position of that low back. You don't want the low back flat into the ground, and you don't want a big arch. You want these bottom ribs tucked gently into the abdomen without pressing the low back into the floor. So just place your hand under your low back and just make sure you can get your hand a little bit easily underneath that low back. Okay, so my diaphragms are facing each other. I'm going to make sure my neck is long and my chin is tucked, so I'm looking down at my chest. And then I'm going to take nice big inhales in through my nose. And when I take an inhale, I'm going to put my hands at my lower ribs. And I'm going to take an inhale, giving my ribs a little bit of pressure, a little bit of proprioceptive input, so that I can help push my ribs out into my hands. And I'm not doing this by active muscle contraction, except for the diaphragm. What's happening is I'm filling my lungs so much that the ribs move. So you're going to take an inhale, the ribs move lateral. Exhale also through the nose if you can. The next part of the breath is here in the abdomen. And so what you want to get is you want to get the lower ribs moving lateral, and then you want to get a nice dome from the base of the breastbone to the top of the pubic bone. Not a pooch, so you're not pushing your belly out. You shouldn't create an arch in the low back. It's not pushing your belly out. Again, you're filling your lungs so much that it distends the abdominal contents, all those organs, and they have to go somewhere, so they push out. So let's do that again. Take an inhale. Lower ribs move out to the side, belly domes. What you also should be aware of in 360 breathing is that it's also happening through the back. You've got really large musculature back there, so you're not going to feel as big as a puff as you do in the abdomen. But if you place your hands in the low back and you take an inhale, trying to inhale so much that the abdominal contents get distended forward, outward, and behind, you should feel that the low back puffs slightly. At the end of that inhale, you might also get this sensation of pressure in the pelvic floor, just really gentle pressure as the organs start to come downward and press gently into the pelvic floor. This is also a really great way to start to train the pelvic floor to become healthier in terms of how it supports the genitourinary organs. And so as you progress this drill, you can bring the feet off the ball and hold the feet up actively into this supine 90 position. That's definitely a little bit more challenging. You want to make sure that you're in a position that you can breathe well, not in a position that you perceive as more difficult. More is not better, better is better. And so that breathing drill is probably part of your homework if you've received this video. If not, and you're just kind of searching for ways to improve the function of the core, this is a great drill to begin to earn that strength again, earn that control again. And really great for people who are in acute pain, especially acute low back pain. You want to make sure that while you're doing that drill that you're not increasing pain. And so only inhale as much, only create as much distension as you can without creating pain. What you can do to amp up the activation of some of those deep core muscles is make a hiss or a tss sound at the end or at the exhale. And so you would take your sharp breath in, filling the lungs, 360 breathing, and then make this tss sound on the exhale. That tss sound, as you gently pull the belly button in, helps to activate those deep core muscles just with a little bit more force. And so that can be a way to progress this drill as well. If you're not sure whether or not that drill is appropriate for you, if you need a little bit more coaching, make sure you contact a professional that can guide you through 360 breathing and teach you how to get out of pain.